Hi, Michaela. My name is Kelly. I'm a student physical therapist. Is it okay if I palpate some structures on the upper rib cage area and your upper back for educational purposes?
Yes.
Okay. So we're going to begin with the sternum. We're going to palpate 4 different structures on the sternum. We're going to start right in here in this divot. This right here is called the suprasternal notch. We work our way down to this first hard part right here, and this is called the manubrium of the sternum. So working our way down even further, we're going to feel this ridge. Once we feel that ridge, that's the manubrium turning into the body of the sternum. You can feel this structure all the way down till we get to the divot. The hard part inside that divot is going to be called your xiphoid process. During CPR, you want to make sure you do not perform CPR down here on the xiphoid process because it can be very detrimental to the patient. The next structure we're going to palpate is going to be the first rib. So to find the first rib, we're going to find our clavicle to the manubrium. And we're going to go right underneath the clavicle and deep, and we'll actually be able to feel the first rib where it attaches to the manubrium, right in here. So since the first rib does not have much of a costal cartilage, we're going to work our way down to rib 2. And right underneath rib 2, we'll be able to feel some costal cartilage in there. I'm going to ask my patient to turn over into the prone position. And from there, we're going to palpate some different structures on the back. So starting at the spine of the scapula, we're going to work our way in. And right in here, we're going to find T3. So following the rule of 3 to find the transverse processes for T1, 2, and 3, we're going to go straight across. So right in here is where we're going to find the transverse process of T3. The next structure we're going to find is T7. So to find T7, we're going to find the inferior angle of the scapula and work our way in here, right in here. The last structure we're going to find are the rhomboid muscles. So to find those, they start at, we know they originate from C7 to T5. So we're going to find C7 here, and then we're going to find T5 by finding T3 first, and then working our way down right here to T5. So we know that these muscles are going to originate from here, and they're going to insert on the medial border of the scapula. So right in here. So you can strum these fibers going here. Now in order to activate these muscles, I'm going to ask my patient to place her hand behind her back and lift her elbow to the ceiling. Right there, I'll be able to feel those muscles contracting. All right, thank you, Michaela.